Hey guys, Lori here, pharmacist. So, wanted to jump on here and just talk a little bit about what's going on with the coronavirus, the statistics. So at this point, worldwide, we're at over 98,000 cases, almost 100,000 cases, 98,066, according to this website I found, worldometer.info. Deaths are at 3,356. However, over 80,000 of the cases were in China and over 3,000 of the deaths were in China. So globally, we're really looking at less than 350 deaths. And that's actually 3.4% death rate globally, which is not huge. Everybody I've read about in the US anyway has had underlying health conditions. If you watched my video a couple of weeks ago on the autopsy results out of the guy, 50-something-year-old man out of Wuhan, China, and you followed the drugs that he was on, I mean, the drug therapy alone was lethal, okay? He was on 2 HIV drugs, then he was put on an antibiotic. All 3 of those drugs had the potential to cause cardiac condition or cardiac issues. He died of cardiac arrest. Then the breathing treatment they put him on was, I'm not even really going to go into it. It's such a weird breathing treatment. I don't know why they chose that, and it could have deadly consequences. It can cause really severe reactions, and it's something that's been used to treat lung cancer. It's also used IV to treat leukemia. He was put on a steroid. That would be for inflammation more than likely in the lungs. I don't know why he wasn't put on a short-acting inhaler bronchodilator like albuterol. That's usually first line when somebody can't breathe. As far as I know, from what I've read, I don't know why it would be any different with acute respiratory distress syndrome. But anyway, lethal drugs. If he was my relative, I'd be looking into a lawsuit. Of course, this is over in China, but it just was another example of after what we went through, my daughter and I, with her baby being born in the hospital, and the overreaching medically unnecessary procedures, potentially life-threatening procedures that they wanted to do to the infant who was barely sick, breathing on her own within 24 hours off of oxygen. I mean, it was insanity. And now I read about this man, and this is why it's made me pull into question whenever I'm reading about a death now of anybody. When you tell me it was an influenza death, it was a pneumonia death, it was whatever. What were you treating these people with? Because I got to ask, okay, if that little man had come to Lori's house, I would have seen to it, let's just say he was my brother. I would have seen to it that if he was having breathing issues, we got a short-acting bronchodilator on board like albuterol. Start with an inhaler, maybe need a nebulizer to see how they're doing. Then you put them on a steroid, short-term steroid therapy, because that's a strong anti-inflammatory that's going to back up what the short-acting bronchodilator is doing. Why are you putting them on HIV drugs that have horrible, horrendous side effects, even though they are antivirals? This is a new virus. You had all the side effects that this guy could have, including cardiac issues, and yet you put him on that. And then you put him on an antibiotic that one of the side effects is cardiac issues. I guess because he had pneumonia. I mean, I don't have the patient chart. I don't know. Anyway, you come to Lori's house. We'd have done a short-acting bronchodilator, probably a short stint of steroids. We would have had him juicing. I would have been juicing for, pretend it's my brother, to boost that immune system, to give him the nutrition IV he needs to build his immune system so he can fight off the virus naturally. Did he have any underlying conditions? I don't know. None of that was listed. But I can just tell you the drug therapy that they chose, in my opinion, from what I know, is the reason the guy died. And he died of cardiac arrest, in case I didn't say that. So very sad. But now it makes me call into question everyone that's treated by this medical system, because it's come to a point that it's so overreaching and so, I don't even know what, invasive is a good word. So, all right, we got 12 deaths in the U.S. 5 of those deaths, as far as I know, are in a nursing home facility. I mean, that's a say no more. Nursing home facilities in general in the U.S. are the most depressing, number one, and horrible places anybody can live. They're put on tons of drugs. They're vaccinated to the hilt. And they feed them crap. These people literally are just existing. And I've worked as a pharmacist for a pharmacy that serviced nursing homes. Also was responsible for going into the homes and looking over charts and, doing stuff like that. We would visit the nursing homes and they would have a relationship with their pharmacists. And it was, oh gosh, it was bad. And it hasn't gotten any better. I did nursing home, long-term care patients at the last job I was at. That was one of the, and I wasn't talking to the patient actually. It was a caregiver, like an LPN or a nurse, but so flipping depressing. So coronavirus, zinc, vitamin C is great to have on hand. Boost your immune system. Eat the fruits, especially citrus fruits, I would advise, because they're high in vitamin C. Organic oranges, organic grapefruit, if you like grapefruit. I love grapefruit. Organic apples, vegetables. Up your vegetable intake, please. Broccoli, cauliflower, the greens. Eat salads. Eat steamed broccoli or even roasted broccoli, with good seasoning on it. Which, by the way, I think I'm going to do a few recipe type videos just to give you kind of an idea of what I eat and the type of things, and maybe some just good ideas overall in general. I think it'd be kind of fun. Keep your hands clean. Oh, hand sanitizer. Oh, it's going for like $100 plus on Amazon. I don't know. They said they pulled some, but my daughter sent me a link yesterday. I was like, yeah, I didn't buy hand sanitizer when it was $1.49 a bottle. I'm definitely not buying it now that it's $99 for 3 bottles or whatever the heck it is. That is freaking hilarious to me. I just, don't even get me going down the hand sanitizer bunny trail. It is just a pet peeve of mine. I just feel like we survived thousands of years without hand sanitizer, and now it's suddenly like the savior of the world. Oh my gosh. Do practice good hygiene, habits. I wash my hands very frequently. But I'm just not OCD. I feel like that's what a strong immune system's for. But I don't go to the grocery store and push the cart and then get in the car and rub my eye or, start eating something and put my hands in my mouth. I constantly think you've been where it's dirty, get home, wash your hands. Of course, hydrochloric acid in your stomach is really caustic to any germs, but what else? I think that's about it. I could go on and on. I've got some other things I want to talk to you about. But just to let you know, I am available. Since I met with this family last week, I feel I want to open up doing one-on-one counseling services with parents. Something that drives me completely insane. And I might do another video about this that's more specific and tell a few stories, is how these doctors are talking down to you as parents. I just cannot even tell you how that irks me. And, as a pharmacist, I have gone head to head with, I don't even know how many doctors in my career. But It's something I'm good at. And not that I want you to go head to head with your doctor. That's not what I'm saying. But knowing the stance that you need to take, giving you the ability to take that stance, giving you the confidence, I think is what I'm trying to say. And that's something I want to offer my services, and I am offering my services for. In addition, I'm open for health coaching, medication reviews, medication therapy management. I want to work on some videos about boosting your child's immune system and how to handle your child when they're sick. There seems to be a real loss because the medical community doesn't give you any strong direction other than treat the fever, and bring them to the ER. We're going to shoot them up with antibiotics. If it looks like a flu, we're going to give them Tamiflu, which is deadly. It's pretty bad. All right. Anyway, love you guys. And, it's The Wise Pharmacist. There's a section, Ask the Pharmacist, if you have any questions. Again, I'm here for you. What we can do if set up 15-minute consults at no charge, and then figure out what direction you need to go and work to getting you to your health goals. All right. And your children to your health goals for them too. So again, I'm here for you. I really have a heart for parents out there who are trying to do battle and trying to learn everything. And that's what I'm here to help you do, is to learn so you can make an educated decision for yourself and your family. All right. Talk soon.